Hi there, everybody. I'm Aditya Bansal, and welcome to Digital Health on Air. Today, I'm joined by Michelle Stansbury, a well-known voice in healthcare innovation and a visionary leader and leader for the groundbreaking work being done at Houston Methodist in the Houston area, in the healthcare hub and the TMC ecosystem. Michelle's the Associate Chief Innovation Officer and the VP of IT Applications at Houston Methodist. And Michelle, we're so thankful to have you here. I've got a chance to meet you before at doing a panel in Houston before. It's just been a really great to get to know you. And you really stood out to me in kind of the times that we've met before, just like having a very forward-looking, positive way of thinking about how change can happen with healthcare IT. So welcome to the show.
Thank you for having me on. Looking forward to our conversation.
So you've been at Houston Methodist for, over 30 years at this point. Would love to kind of start our dialogue today with a little bit about your story. How did you start your career at Houston Methodist? What was your background and kind of what took you over these 30 years, these three incredible decades to get you to the point where you're now, this recognized leader in innovation in healthcare?
I started my career like any good Texan does, especially in Houston and oil and gas.
I was going to say it has to be
Um,
oil and gas. It has to be something
and I
energy.
was I was in oil and gas for, a little bit of time and then moved over into technology. So for any of those Houston individuals that remember Compact Computer, I
I'm
was.
not. I remember Compact Computer as a Californian. It was a big, big deal.
Yep. So really enjoyed my time there, and I'm always interested in hearing from others who joined healthcare from a different career because typically what you'll find is either it was because of family, right? The family
Sure.
was in
Yeah.
healthcare, always, went into healthcare, or it was because of a certain um, problem or something occurred in their life
Like
that
part of
made
their
them
lived experience.
right. And mine was my very firstborn had problems when he was born, was in Texas Children's, another great
Okay.
facility for, about a month. And once you kind of get past the initial shock and everything of what you're going through, both my husband and I, got a chance to start looking around at what was occurring overall, with the healthcare professionals and everything else, and just thought, wow, this really looks like it could be a very rewarding career.
Oh yeah.
Um, we did. We made overall, my husband actually went back to school to get into biomed engineering. I was in my background was in finance and really project management. And so, just thought my skills hopefully could transfer over. And was very fortunate enough that Houston Methodist gave me the opportunity because I will tell you the other institutions I interviewed with kept telling me I was too overqualified, too overqualified. So, thank the Lord, I was able to get on at Houston Methodist and it just have had a very rewarding career there. And, couldn't imagine being at any other place, which is another reason why everyone's like, why have you been there? Why so long? Right? Because it is somewhat unusual, especially somewhat these days. It's not unusual for Houston Methodist. I will say that. We have a lot of staff that are very long tenured at Houston Methodist. So very grateful for my time there.
I've tended to found like talking to CIOs and other healthcare leaders that places that do great work tend to attract employees who want to stay there. Because not only do they do the great work and a service is something greater than themselves, but they also can build great careers there along the way. And so as you kind of grown into this role, what are some of the, there must be some like really highlights in kind of the last 30 years projects, things that you've done that you're exceptionally proud of. I'd be curious to get what some of those might have been because it's a storied career at 30 years at one, storied institution.
Well, it really, I will just give you a couple. I mean, one that I was really proud of because at one point in my career at Houston Methodist, I was really working for Houston Methodist, Baylor College of Medicine, and Texas Children's.
Yeah.
And we were way ahead of our time, way back. It was 1998, I think is when it was, because it was more before 2000 was they wanted to do something jointly together, right?
Like
Because
the
they were
three
very tight.
institutions together.
Right. Well, because Baylor and Methodist at that time were really close, and Baylor and Texas Children's were really close.
Okay.
Right. And so it was, what could we jointly do together? So the CIOs got together and decided that they wanted to create an enterprise master patient index across the three facilities. So if you were seeing a Baylor physician and came to Methodist, we already had all your information. You didn't have to re-register and give all
Right.
of those things. And same thing over at Texas Children's. So, yeah, at one point, a third of my salary was being paid by each, and I got to know Baylor really well. I got to know Texas Children's really well. And we did the project, and it turned out it was, very good. Way ahead of our time, though, I would say, because now it's, there's look at how the interoperability they're trying to do
Yeah,
with
yeah. I mean, it's interop
EHRs.
before interop, right?
Right, and so anyway, after it was done, I went to our CIO and I'm like, you're wasting me. I'm like, the program's up and running, it just needs to run. And so he basically went to the other ones and said, I'm taking Michelle back full time. She'll still manage the program, but I have other things to do for her. And so, my career just overall sort of grown from that, taking on different leadership roles overall within IT, creating new programs, you know, um, we didn't have a project management office, created that one. We didn't have a traditional BI data warehouse
Yeah,
group,
sure.
created that one overall. So, but I will tell you probably the one that has just stood out to me the most that I enjoyed the most was when we transitioned to Epic.
Okay.
So,
Yeah, big project for sure.
right, huge initiative, from our physician organization to our research institute to overall of our different hospitals. And the thing that our key leader said is that I want this one to be the best Epic implementation ever,
Hands down. Yeah.
hands down. So we knew that all going in. So, it was a 3-year project. We went, we had Big Bang Live that we went kind of our physician organization to our main hospital and then 3 and 3 because we had six other hospitals at the time. It went extremely well. I will just tell you, we were back to normal operations within 2 weeks. We were back to normal revenue within 2 weeks, overall of getting those up and running. And so tremendous. It was just a really great
That's
project.
something to really to be proud of. And I think like the story around the revenue piece is often one of the most challenging parts when you need to do a big IT project, right? Because often schedules get limited to allow for extra documentation at the elbow
Right.
support, that sort of stuff. And you're back to regular revenue in 2 weeks. I mean, I can't imagine that story going any better.
Well, but here's where I would tell you, which is kind of, everyone has these lessons learned, right? Overall,
Sure.
kind of things that you do. And this is what makes overall, even with what we're doing with innovation right now, is that IT and operations work so hand in hand and closely together that you wouldn't know one from the other.
Oh,
And that's
interesting. Okay.
exactly what happened overall with Epic. Operational leaders stood up, they took accountability for their areas. We worked hand in hand together with them overall in IT because we know how to install things. We know how to make sure that they're working appropriately. But if operations is not adopting things and functioning appropriately, it doesn't work. Technology is not going to work on its own. So, from that aspect, that was overall not just an accomplishment, that I feel, but an accomplishment overall from Houston Methodist as a whole to be able to show this is a standard. And so we've taken that standard on several other things. Matter of fact, I'm working on a Workday project right now. We have set up that project similar to what we did with Epic, taking operational leaders out of their normal day-to-day roles and putting them on a project team along with IT resources and who's helping us implement. And that is your total job. Your total job
Interesting.
right
Yeah.
now
So
is
it's like you are seconded, so to speak, into IT or vice versa.
right. Well, and that it doesn't, it's not seen as an IT project because they're not really
Yes.
setting
So
up
it's an
this
institutions project,
project team.
right?
That's right. Right. So you've got those operational individuals and leaders that are now functioning as one team with IT together.
Interesting. I want to go back a little bit. You were talking about kind of this EMPI turn of the century project you guys did between 3 institutions. And there's something, I think there's something special about how Houston does healthcare. And, both at the Med Center and the Texas Medical Center, for those who don't know, and they're in that part of Houston, you have so many different healthcare institutions. I'm kind of curious why, and you've been in this ecosystem for 30 odd years. You have like the Houston blood going through you with the oil and gas background in you. What about Houston has been so special about healthcare innovation?
Well, this is what it just overall kind of shocks me in some instances is people don't really think of Houston. And I really hope that we're changing that, slowly but surely of being an innovative city. And I'm not just talking about healthcare in general. I mean, it's overall, in other industries here.
Sure.
I don't think that they really, they think of right? California. And I think people are thinking Austin, but they're not really
Yeah.
thinking Houston. But that's not true. I think there are certain organizations who have the overall mindset of how are we transforming our industries? And I would say that as a whole, healthcare, yes, that's my focus, right? But the transformation comes when individuals are really kind of thinking out of the box and how can we begin to do things different? And there's a reason why. People don't go into just innovation of thinking, hey, this is cool, this is fun, right?
Yeah, just shiny penny type of stuff, right?
Right. There's true problems we're all trying to solve. And I want to it back then it was, we have our patients talking about the EMPI was our patients complaining. We don't know why it is that we have to sit and give the same information over and over again. Baylor doc, you're sending me over to Houston Methodist. Why can't Houston
Why is it
Methodist?
different to me as a patient, right?
Right, exactly. Why can't you all have my information already? So it's an easier transition. So there's that patient journey, which everybody is trying to make you sure, it's frictionless. I just love that word. But it was way back when what we were trying to do, right? And so that's what I think it's overall, it's that you find the right individuals who just have the drive and determination, who want to solve those problems and do it in a very transformative way. And I will say, which kind of leading up into how did we even start our Center for Innovation? I mean, this got into overall healthcare. I don't know if you can remember, I guess it's been 6, 7 years ago, when so many outside companies outside of healthcare thought they
Yeah.
could step in and solve healthcare.
Oh,
Ah,
yes. We
right?
had the Googles, we had the Microsofts, we had everyone under the sun
JP
selling
Morgan,
software,
yeah, all
Salesforce. Yeah.
yeah, everybody was like, oh, you all can't do it. We're going to step in. We're going to create a healthcare arm and we're going to solve healthcare. Well, what they were trying to solve was not, they didn't want to build hospitals. They didn't want to do that, right? They wanted to be able to solve what the issues were overall with patient journeys, right? So that's what kind of jump started overall. And I think that's where it is. We have a certain group of individuals who are like, no, we know what our problems are. We live it every day, right? So we need overall, how can we end up transforming our own self? I mean, we had this saying way back when we can either be Uber or be Ubered,
Yeah,
right?
sure. You could be
Just
the taxi industry, right? Like, and now we don't exist anymore, right?
well, that's kind of right. I mean, you think of Blockbuster, you think either there's multiple things that are out there, right? And you could either take the stance, oh no, nobody knows how to do this, and we're not going to do anything, and we do it great as we do right now, or we can go, no, we know we're not doing it great, not the way that we want to. So what are the things that we're going to do to transform to solve these problems ourselves instead of just waiting around thinking somebody else could do it for us, right? We're not.
There's a really interesting pull through, I think, on some of this, which is enablement culture,
Mhm.
right? Which is around like you've built a culture, you kind of stood up a culture that says, hey, like we talk about a lot here at Luma, just as in terms of like the scarcity culture, right? Like tomorrow may not be here because something may like eat our lunch or the market may change. And you seem to operate like very similarly from a cultural perspective that, we don't want to do, we want to be Uber or be Ubered, the verb form,
Right.
right? So how have you kind of embodied that in the culture? How have you pushed that in the teams to kind of think through that scarcity mindset?
Well, I think look, our overall, mission and vision really to provide the best quality care, service, and innovation. And you'll hear our CEO talk a lot that it's not quality or service, or it's the and. And the
Sure.
and means that you don't just carve off one and say, oh, we're not doing that. It all ties in together. And so for me, that's the culture he has set at the top, which filters down overall entire organization, right? So everyone understands of see a problem that that we need to address, don't just be quiet, think about it, bring it up, talk about it. If there's solutions you've seen out there, let's bring
Point to
them in.
them.
Let's
Yeah.
see, right? Let's try to make that happen overall. And that's what's overall, proliferated throughout our entire organization. And, we do have a very, very strong culture. It's based on our I care values. And so I would just say it seemed very natural to us. But even overall within the organization, there were key individuals, and I will give Roberta Schwartz, right? Many people know Roberta. She is
Yes.
phenomenal. But Roberta was like, she Loves to learn about new things. It's so interesting. Before it is, we got into overall doing innovation. Didn't know much about IT. Knew IT ran things. Now she's like so involved and can tell you about networks, can tell you about applications, databases, everything. But, she's the one who really kind of spearheaded. She was seeing a lot of things out in the industry, right, of what was going on. So she pulled in groups of individuals, right? Just kind of like-minded individuals who were thinking, right, overall, what's happening in the physician organization. So pulled in that leader. Overall, within, IT, pulled in myself of what's happening with the nurses. And it was just, let's have a discussion. Let's start
Right.
talking. What have you all seen that's out there in the industry that potentially we could start using? And that's what created our DIOP group. I know a lot of people are familiar with our DIOP group, which is now our official Center for Innovation.
Mhm,
But
mhm.
where it comes down to of overall within this culture is this just I keep saying it, but and I don't mean to repeat myself, but it is just this drive and this passion of how can we make what we do better for our patients, better for our clinicians, and create those operational efficiencies because we're all in financial strains,
Of
right?
course.
Overall within the healthcare industry. And so we're very passionate about making that transformation. So, yeah, we all kind of hold these dual roles, and everybody's like, well, how do you do that? And then, well, yes, it was almost like two different jobs, but they all fit very nicely together. And, what's interesting to me is people will ask us all the time, how are you all able to transform so quickly? Right?
Yes, I think that would be a lesson many people would want to learn about.
Well, and it's very easy, and maybe it's very easy for us because maybe it's a part of the culture and overall of the individuals, who have this passion. And that's kind of where I get back. You either have the passion to want to transform things or you don't, right?
Yeah.
I like my job, I like being, and I'm just going to say our nursing staff and our physicians are phenomenal. They work really, really hard, and everybody else within the healthcare institution. Everybody's got great roles of what they're doing to support overall. But there's certain ones who really want to step above and beyond out of that. They still are doing their job, but how can I be a part of overall of this transformational journey? And I will be honest, I was one of them. When I kind of saw that this was a little bit of discussion happening, I want you to know, I went to Roberta and I said, I don't care what it is, I want to be a part of this journey, whatever you want to use me for, right? And so that's kind of how, my role just started overall within the DIOP group that got created. But it's, just getting back, I think it's this culture overall that we have embedded that, we care about the institution. I mean, what you will find when you talk about, in Houston Methodist, great place to work, great, leaders overall who give an environment for people to be able to do what they do best. And at the heart of it, everyone knows our goal is, and we have the same what we go, is the patient is at the center of everything that we do. I mean, even if that means I'm walking down the hallway and I see a patient that's having problems locating of where to get to,
Yeah, let
everyone,
me help wayfind them, right?
and that's what I mean. You find everyone will do that. They'll stop and, oh, can we help you find, are you, do you have any problems? Oh, well, let me walk you there. So if that means I'm late to a meeting or if I'm late for something, people understand
But
that.
you're in service of like the actual mission, right? Like that's actually the raison
It's
d'être.
it's the servant, mission, yes, of overall of what we're doing, and everyone takes that to heart. And I'm just going to say, for me, the reason I, stay there once, great institution, but I really feel like we are trying to do the best for our community, and that makes, that gives me overall of great guidance and of knowing that I am doing my best. Well, I don't do direct nursing care or direct patient care. I'm doing what I can to help those to be able to
To
help.
make that happen, right? What's very clear, honestly, in what you're talking about, Michelle, is like the passion for what you do is like it's like jumping off the screen at me. And and translating that to like concrete real world, how does it happen in the real world? I think the audience would love to hear maybe a little bit about the new hospital at Cypress, the new smart hospital that opened up a couple of weeks ago. Because from what I learned, what I understand, like that's probably, one of those incredibly interdisciplinary activities, opening up a new kind of top rate hospital with all the interconnected technology that's a part of it. Like, it must have had a lot of the culture that you guys have built kind of become in physical form, right? And how does that actually come to life in physical form? I'd love to kind of maybe close us down with the story of how that hospital came to be, kind of how you're able to take the innovation mission and the passion and make that real at the hospital site.
Yeah, well, the interesting part is that started probably about 4 years ago. And we have had our Center for Innovation up, and we were just kind of, um, had thoughts and ideas. And the interesting part was that most health systems don't have the opportunity to build a new hospital from the ground up, right?
Yeah.
I mean,
There's always CapEx projects, but they're not like fresh concrete
you're
builds.
purchasing,
Yes, or there's M&A, right? You're acquiring
right?
some. Yep.
You're acquiring one with. So we felt it was a very unique opportunity. We were already in this innovation space. And what we said is, now that we have it, what are the things that we want that hospital to open live with, right? Now, we didn't understand very specific technologies, right? But overarching themes is, and we came up with 10 bets. We called them the future bets.
Oh,
And
interesting.
actually,
Okay.
and we actually took it to the very first VIVE conference. We were kind of the keynote. It was myself, Roberta, and Dr. Boom, who's our CEO.
Mhm.
And we talked about those 10 bets that we had. And in the overall, like I said, arching themes were we wanted it to have AI capabilities. We didn't want to have any call centers in that hospital. So it is
Sure.
what technologies could we incorporate to make sure that we didn't have to use it? What overall, where was voice? It was going to be voice enabled.
Yep.
What did that mean? We didn't have a
Didn't know
solution.
yet. Yep.
We didn't know, but these were the kind of overarching themes that we had. So that kind of started the journey. And then from that, it was okay, starting to look at overall those technologies and things that were out there. But what we also said was that we don't want it, whatever technology it is, we don't want it to be the first time to be used
Right.
when Cypress opens up. So whenever we found something that we believed was a viable option, we brought it
And battle
in.
tested, so to speak, right? And had gone through
Well,
its bona fides.
well, we did all of that. And then we actually went live in one of our other hospitals. So most everything that is live at Cypress is already being used at many of our other hospitals and have been for some time. One, learn from it. Have overall our staff utilize it. Are we getting the return or the ROI off of that solution? Because we don't do, as I said, innovation, we don't do it just as for the glitz and glamour of everything for it. It has to be solving an overall arching problem for us in an organization.
Yep.
So all of the AI, right? Either it is allowing overall our physicians not to sit and get burnout, right? Overall is what you've heard, but it also too, maybe it is allowing them to be able to get documentation overall done sooner, which allows us to be able to see more patients from everything
Kick
to what
off
we're
rev cycle
using
faster, all that good stuff. Yeah.
in our ORs with the camera technology that we have that is now allowing us to be able to gain the efficiencies to open up more OR time,
It's one of
right?
my favorite things I've heard you guys doing in that like OR optimization through cameras and computer vision. It's so cool.
Yeah. I mean, and that's just overall kind of some of the stories that, kind of have gained, us overall of being able to solve those problems that we're seeing within the organization that helped us. Lots of things that we've done overall on the scheduling side to make scheduling, much easier for our patients when they want to be able to get air. One of the overall things was text-based communications. Everybody loves to text. Everybody hates to get on the phone these days. So why not, right? It is be able, if you get a reminder, text reminder, and that appointment no longer works for you, wouldn't it be great if you could just text
Just
back and
reschedule it
forth?
right there. Yep.
Reschedule it right there, right? So, it's certain things like that. And as I said, there's three kind of main areas that we do. The patient journey, no matter what that is, clinicians, we started off with our doctors with, ambient intelligence. We're now working on for our nurses because they are just as overburdened on documentation
Sure.
as our physicians are. So to, the operational efficiencies that you get with the OR cases, right? That we picked up overall there. But so we'd find solutions, we pilot them, but as overall the hospital, started getting closer, they were hiring leadership, Trent Fulin, who's our CEO, the other ones, again, that's where operational leaders, they stepped in overall with us, because as they were hiring staff, it was up to them to ensure that staff was adopting, physicians
Yep.
knew what they were going to be doing as that hospital opened up. And the very just last piece, and this is where it is that I said, you get operations and IT working together as one team. We were out there 2 weeks. Most of the IT staff was stationed out there for that go live. But
Yep.
I'm just going to tell you, it was phenomenal to see how quickly it opened up and they were functioning all on their own. So when we closed that command center down within 2 weeks, they were good. They
Up
were
and running, fully operational, hitting the
fully
metrics.
operational, right? No issues whatsoever. So now the big key piece, there were a few things that that hospital did open up with because we found them at the last minute, which is we've got a digital whiteboard that's being used. So if you think
Sure.
about the old whiteboards in the room where the
Yeah.
nurses would
Yep.
come in
Yep.
and write your name or whatever, it's totally digital now. So
Love
it
it.
has a whole lot more information. It has a lot of clinical information that the patients could know about their lab tests, their blood pressure, their next pain
Estimated
med.
discharge dates, that sort of stuff.
Right. Any kind of other information they need, plus digital door signs. So now you're not having to tape up the little
No,
flag,
sure. Yeah, totally.
right? Everything, it's all on the door sign digitally. So that's being managed there, along with the patients being able to now send instead of hitting the nurse call button and asking for everything, they can actually send through um, in a secured way to be able to request certain things
Yes,
without
for
having to
service or
hit the
whatever they
nurse call
need.
button.
Yeah.
Right.
I love it.
Exactly.
I love it. Kind of the work around there really, I think, ties into this culture you guys have built, this capability you've built around how do you make innovation not just a thing that happens, but really like embedded into the fabric of how you use technology to deliver care, right? As opposed to technology for its own purpose. And you'd said that a couple minutes ago, and it really resonated with me. And Michelle, thank you so much for spending, 20 odd minutes,
Yeah.
30 odd minutes with us today. Three key themes that really came out to me in our conversation: the culture that you guys have built at Houston Methodist, the passion you personally have for making all this stuff real and actually having an impact on patients, and also providing great opportunities for the caregivers to give their care. And then lastly, I think the execution, making it happen, putting those three things together: culture, passion, and execution. I think it makes for an incredible health system that you guys are running at Houston.
Well, thank you. I can't imagine myself any other place. Yes, I have had several who have tried to, get me to come to go work with them. And I mean, it's a true testament to Houston Methodist, of if not only me, but the many others who have been there for many, many years of just what a great institution it is.
I love it. It's awesome. And thanks so much for joining us on Digital Health on Air. We'll talk soon.
Great. Thank you.